Chakra for giving me a great platform to tell about not so widely discussed event which is known as miscarriage and post miscarriage care, although it's more common than you actually think of. Hi, I'm Dr. Amandeep Kaur, MD obstetrician and gynecologist based in Sonipat. I am a sonologist, fellow gynecological laparoscopy, and masters in cosmetic gynecology from Germany. I have an experience of more than 8 years in this field. So go on with your questions. So let's see what is actually a miscarriage. So when you have a miscarriage, your embryo or fetus spontaneously expel from your uterus before 20th week or fifth month of pregnancy, and what you experience is a heavy flow, clots, cramps for a few days. So the next is okay, after miscarriage, you expect your periods to be back to normal in 4 to 6 weeks. But meanwhile, you need to keep a check on certain things so as to prevent any infection, and you have to look out for the danger signs. Firstly, if there is bleeding or cramps for more than 2 weeks of duration, if you have fever more than 100.4 degree Fahrenheit, you experience chills, or you are having a foul smelling discharge. So that is an indication for infection. So you need to take a good care of yourself and body after miscarriage for a healthy recovery. You need to hydrate yourself, have a good sleep, light exercises, meditate, and good nutrition. And if possible, now is a good time to invest in your health more than you typically think of. So miscarriage impacts a woman both mentally, physically, as well as emotionally, as she tends to get attached to her fetus very early on. So there are intense feelings of grief, anger, guilt, like मैंने ये क्या करा या मैंने ऐसा क्या खाया या मैंने ऐसा क्या करा जिस वजह से ये हो गया. But there is no normal way to react to a loss. So women can try meditate, healing sits bath, or salt baths. Try writing journals, practice self compassion, and please do involve your partner in all this also. So after miscarriage, you need to visit your gynecologist. She or he might advise you get an ultrasound done to see if there is any products remaining inside the uterus, which is also known as incomplete abortion. Ultrasound is done so as to prevent any infection or any other complications in future. So if everything seems good, your doctor would advise you to come back after 6 weeks, and you can resume your work as soon as you feel well and bleeding has stopped. So if you're planning for another pregnancy, do visit your doctor before. Wait for at least 2 menstrual cycles so that you regain back your energy and also regain back your normal menstrual cycle rhythm. So that's it. So miscarriage is actually a loss. It's a loss of pregnancy and future baby you were thinking of. It's important to get through this process physically, emotionally, and mentally, which can be hard. You can also take the help of some counselors or therapists for the same, and try to divert yourself into new activities. So keep in mind that your partner, your husband, is less likely to have developed the same amount of attachment you had with your fetus before miscarriage. So emotionally, you two are at different levels. So do talk about your feelings and vent it out to your partner, because that is what is very important in your relationship healing also. After miscarriage, it depends upon you. Like, ideally, we tell patients to wait for 2 menstrual cycles after miscarriage. So that's it. Thank you, and uh, please follow us for more information on all these things. The main thing is that post miscarriage care is very important. Firstly, you need to visit your doctors very You need to visit your doctor very regularly. You need to take their advice very seriously. You have to maintain a personal hygiene. You have to change your pads regularly. You have to look out for the danger signs. And also, you need to, have a gap between the miscarriage and planning your next pregnancy also. So that is a very important thing. So thank you so much for listening to me. Thank you, Baby Chakra, for providing us with this platform. Do follow us for more such great information on pregnancy, on babies and fetus.